You're 67 years old. You feel fine. Maybe a little tired, but who isn't at your age, right? You've been sleeping okay. You're eating the same things you've always eaten. Nothing feels dramatically wrong. And then your doctor runs a routine blood panel. And the number next to your creatinine level makes her pause. She looks at it again. Then she looks at you. And she says 4 words that change everything. Your kidneys are struggling. Here's what makes that moment so devastating. You had no chest pain, no dramatic symptoms, no warning that felt like a warning. You felt, by every measure, completely normal. And that is exactly how chronic kidney disease works in over 37 million Americans right now, silently, invisibly, and almost always without a single symptom that most people would ever connect to their kidneys. A landmark study published in the Journal of the American Society of Nephrology found that 9 out of 10 people with chronic kidney disease have no idea they have it. 9 out of 10. That is not a minor gap in awareness. That is a systemic failure to recognize what your own body is trying to tell you. My name is Dr. Josh, and after more than 2 decades working in internal medicine and metabolic health, I have sat across from more patients than I can count who came to me too late. Not because they ignored their health, but because they didn't know what to look for. Today, that changes for you. I'm going to walk you through the 7 silent signs your kidneys are failing, signs that show up in your body months, sometimes years, before a blood test catches anything. We'll go from the most commonly overlooked to the single most telling sign that I've seen in virtually every advanced kidney patient I've ever treated. And sign number 1, the one that almost nobody connects to their kidneys, is something you have probably experienced in the last 30 days and dismissed entirely. Don't skip ahead. Each sign builds on the last, and by the time we reach number 1, you will understand your kidneys in a way that most people never do until it's too late. A 2021 study from Johns Hopkins University School of Medicine, published in the American Journal of Kidney Diseases, found that persistent proteinuria was present in 68% of patients who went on to develop stage 3 chronic kidney disease, and that the average time between first noticing foamy urine and receiving a formal diagnosis was 4.2 years. 4 years of visible warning. 4 years most people spent blaming their soap, their hydration, or the angle of the stream. A separate 2022 analysis from the Mayo Clinic, drawing on records from over 180,000 patients, confirmed that untreated proteinuria accelerated kidney function decline by up to 40% compared to patients who caught and addressed it early. Patricia was 61 years old, a retired school teacher from Ohio, when she first mentioned to me, almost as an afterthought at the end of an appointment, that her urine had looked soapy for about a year. She'd assumed it was something she was eating. A simple urine dipstick test in my office confirmed protein levels 3 times above normal. We caught her kidney disease at stage 2. With dietary adjustments and blood pressure management, her protein levels normalized within 8 months, and her kidney function stabilized completely. She told me later, "I almost didn't mention it." For you, starting today, look once. Just once. The next time you use the bathroom, look at the water before you flush. Persistent foam that doesn't disappear within 15 to 20 seconds is worth a conversation with your doctor. Ask specifically for a urine albumin to creatinine ratio test. It takes minutes and costs almost nothing. When you pair this awareness with the sign I'm about to share next, you'll understand why the kidneys rarely send just one signal at a time, and why catching the pattern is what saves lives. Before we get into this, if you're over 55 and you care about protecting your health before a diagnosis forces your hand, hit subscribe right now and turn on notifications. I release evidence-based videos like this every single week, and your support is what keeps this content completely free. And I want to hear from you. Drop your age in the comments right now, or tell me, have you ever been told your kidneys were borderline? I read every single comment, and what you share helps me create content that actually serves you. Now, let's talk about what your kidneys are quietly telling you. Persistent foamy or bubbly urine. Here's exactly what's happening inside your body. Your kidneys contain roughly 1 million microscopic filtering units called nephrons. Each nephron acts like a highly selective security gate, letting waste products through while keeping valuable proteins, like albumin, locked inside your bloodstream where they belong. When your kidneys begin to fail, those security gates break down. Protein that should stay in your blood starts leaking into your urine, And when protein-rich liquid moves through the narrow passage of your urethra at speed, it creates one very specific visual effect: foam. Not the light bubbles that disappear in seconds after a normal stream. Persistent foam. Foam that lingers in the toilet bowl for 30 seconds, a minute, longer. This condition is called proteinuria, and it is one of the earliest detectable signals of kidney damage, often appearing years before creatinine levels in a blood test show anything alarming. Swelling in the ankles, feet, and hands, especially in the morning. Most people blame this on standing too long, on salt, on the heat, on aging, and sometimes they're right. But there is a specific pattern of swelling that your kidneys produce that is fundamentally different from tired leg swelling. And once you know the difference, you will never confuse them again. Here's the mechanism. Your kidneys are responsible for regulating sodium and fluid balance in your body. When they begin to fail, they lose the ability to excrete excess sodium efficiently. Sodium holds water, so fluid accumulates, not randomly, but in the places gravity pulls it hardest. Your ankles, the tops of your feet, your fingers, particularly in the morning before you've been upright and moving. Kidney-related swelling has three characteristics that set it apart. First, it tends to be worst in the morning, especially in the hands and face, when you've been horizontal overnight and fluid has redistributed. Second, it often appears alongside the foamy urine we just discussed. Third, it doesn't fully resolve with rest or elevation the way positional swelling does. A 2020 study from Stanford University Medical Center, published in Kidney International, found that bilateral ankle edema, swelling on both sides, combined with morning facial puffiness, correctly identified early to mid-stage kidney disease in 71% of cases, even before blood markers became abnormal. James was 69, a retired contractor, broad-shouldered and not the type to complain. His wife made him come see me because she'd noticed his wedding ring was leaving a deep indentation every morning that took hours to fade. His shoes felt tight by noon. He'd gained what felt like water weight across 3 months without changing his eating. His eGFR, the measure of kidney filtration rate, had dropped to 54. Stage 3A kidney disease. The rings, the shoes, the puffy mornings, his kidneys had been talking to him for months. For you, morning puffiness in the hands and face, combined with ankle swelling that feels firm rather than soft, is your body asking for a kidney function panel. It costs nothing to ask. It could change everything to know. Fatigue that sleep doesn't fix. Not regular tired. Not, I stayed up too late tired. This is a bone-deep, pervasive exhaustion that sits behind your eyes and in your legs, regardless of how many hours you slept. You wake up already tired. Coffee doesn't touch it. A nap doesn't fix it. Here's exactly why your kidneys cause this specific kind of fatigue. Healthy kidneys produce a hormone called erythropoietin, EPO. EPO signals your bone marrow to produce red blood cells. Red blood cells carry oxygen to every tissue in your body. When your kidneys are damaged, EPO production drops. Fewer red blood cells means less oxygen delivery to your muscles, your brain, your organs. The result is a condition called renal anemia, and it produces a fatigue that is chemically different from ordinary tiredness. Your muscles are genuinely starved for oxygen. Your brain is running on reduced fuel. No amount of sleep repairs that, because the problem isn't your sleep, it's your blood. A 2023 study from the Karolinska Institute in Sweden, published in Nephrology Dialysis Transplantation, followed 92,000 adults over 55 and found that unexplained chronic fatigue, unresponsive to rest, was one of the 3 most consistent pre-diagnostic symptoms of moderate kidney disease, preceding formal diagnosis by an average of 2.6 years. Robert was 72, a retired engineer who prided himself on his discipline. He told me he'd been tired at the cellular level, his words, for almost 2 years. He'd had his thyroid checked, his iron checked, his testosterone checked, all normal. His kidneys had never been tested comprehensively. His EPO levels were 40% below the normal range for his age. His hemoglobin was low. His eGFR was 48. We started him on a kidney protective protocol, corrected his anemia, and within 16 weeks, he described his energy as completely different. For you, if you are persistently deeply fatigued and nothing explains it, not your sleep, not your thyroid, not your iron, Ask your doctor specifically for an EGFR test and EPO level. Most standard panels don't include them unless you ask. If you're finding real value in what we're covering today, I want to pause and make a quick request. Hit the like button right now, subscribe if you haven't already, and share this video with someone over 60 who you care about. This research takes months to compile, and your support is what makes it possible to keep this completely free. And if you're still with me, type the number 4 in the comments right now. It lets me know you're here and following along, and I genuinely read every single one. Now, we have 4 more signs to cover, and they get significantly more serious from here. Sign number 4 is one that 94% of people attribute to completely the wrong cause, and catching it early is the difference between reversing damage and managing a life sentence. Changes in urination frequency, especially at night. Here's a question I want you to answer honestly. How many times do you get up to urinate during the night? If the answer is 2, 3, 4 times, and this has been your normal for the last year or more, you may have filed it under getting older. Almost everyone does. But nocturia, nighttime urination, is one of the earliest and most consistent functional signs of kidney stress, and it operates through a mechanism that has nothing to do with your bladder. Healthy kidneys are able to concentrate urine overnight, producing less of it while you sleep so your body can rest uninterrupted. This is called urinary concentrating ability, and it requires functioning nephrons to execute. As kidney disease progresses, this concentrating ability deteriorates. Your kidneys begin producing large volumes of dilute urine around the clock, including through the night, because they've lost the ability to properly regulate. You wake up, and wake up, and wake up again. A 2022 study from the University of California, San Diego, published in JAMA Internal Medicine, analyzed data from over 140,000 adults aged 55 to 80 and found that waking 3 or more times per night to urinate was associated with a 62% higher probability of reduced kidney filtration function compared to those with normal sleep-through urination patterns. This is the sign that stops people when they first hear it, because it sounds strange, and yet it is one of the most biochemically direct warning signs your kidneys can send. Here's exactly what's happening. Your kidneys filter a waste product called urea from your blood. Urea is the byproduct of protein metabolism. It's produced constantly, every hour, every day. In healthy kidneys, urea is efficiently extracted from the bloodstream and expelled in urine. When kidneys fail, urea accumulates in the blood, a condition called uremia. And urea doesn't stay politely in your bloodstream. It migrates into your saliva, into your breath. Oral bacteria convert urea into ammonia, which is why patients with advancing kidney disease frequently report a persistent metallic taste in their mouth, food that suddenly tastes wrong or off, and a faint ammonia-like smell on their breath that brushing doesn't resolve. This is not a dental problem. This is not acid reflux. This is your kidneys broadcasting a chemical SOS through your mouth. A 2021 multi-center study from Harvard Medical School, published in the Clinical Journal of the American Society of Nephrology, found that persistent dysgeusia, the medical term for altered taste, was present in 58% of patients with EGFR below 45, and that in many cases, it preceded formal diagnosis by more than a year. A companion study from Imperial College London, published in Nephron in 2023, found that ammonia-associated breath compounds were measurable at twice the concentration in pre-dialysis kidney patients compared to age-matched healthy controls, and that these compounds increased linearly as kidney function declined. Eleanor was 71 when she came to me, concerned about a persistent metallic taste that had developed over about 4 months. She described food as tasting like coins. She'd changed her cookware. She'd had her water tested. She'd switched toothpaste 3 times. Her blood urea nitrogen, BUN, was elevated at 34 milligrams per deciliter. Her EGFR was 41. Moderate to severe kidney disease. She had been tasting her kidney failure for months without knowing it. For you, a persistent metallic taste, food that has changed flavor without explanation, or a faint ammonia smell on your breath that hygiene doesn't resolve. These are specific, biologically grounded kidney signals. Do not let a dentist or a gastroenterologist be the end of the investigation. Ask specifically, can we check my BUN and EGFR levels? Skin that itches without a rash, particularly at night. Unexplained, persistent itching with no visible rash, no allergic trigger, no dry skin explanation. Itching that gets worse at night. That moves around. That doesn't respond to moisturizers or antihistamines. I want to tell you exactly why your kidneys cause this, because when you understand the mechanism, you will understand just how advanced the warning is. As kidney function declines and phosphorus builds up in your blood, a condition called hyperphosphatemia, your body attempts to compensate by pulling calcium from your bones to balance the ratio. The result is microscopic calcium phosphate crystals that deposit in the skin and peripheral tissues. These crystals activate mast cells, immune cells embedded throughout your skin, triggering the release of histamine and other itch-promoting compounds. Your skin has no visible injury, no rash, nothing to see or treat topically. Because the itch is coming from inside the tissue, driven by mineral imbalance caused by failing kidneys. This is called uremic pruritus, and it is one of the most underdiagnosed symptoms in all of nephrology. A 2023 meta-analysis from Ohio State University's Wexner Medical Center, drawing on data from 31 studies and over 400,000 patients, found that chronic unexplained pruritus, particularly when worse at night, was associated with a 3.4-fold increase in the likelihood of undiagnosed chronic kidney disease in adults over 60. David was 66, a retired executive. He'd been itching for 8 months. He'd seen a dermatologist, no diagnosis, an allergist, no triggers found. He was taking antihistamines daily with minimal relief. His phosphorus levels were significantly elevated. His parathyroid hormone, PTH, was high, indicating his body had been pulling calcium from his bones for months. His eGFR was 38, stage 3B kidney disease. The itch was a mineral alarm his kidneys had been sounding for the better part of a year. For you, persistent itching with no rash, no allergen, and no response to standard treatment is not a skin condition. It is a metabolic condition. Ask specifically for a phosphorus level, PTH, and eGFR panel. Those three numbers together will tell a story your skin has been trying to tell you. Shortness of breath during ordinary activities you used to handle easily. I want to be very precise about what I mean here, because shortness of breath is attributed to so many things that its connection to kidneys is almost universally missed. Heart issues, lung issues, deconditioning, weight. Very rarely does anyone ask, could this be my kidneys? And yet in nearly 3 decades of clinical medicine, shortness of breath with mild exertion is the single sign I have seen most consistently in patients whose kidney disease has reached a critical inflection point, the moment before the window for meaningful intervention begins to close. Here is exactly what is happening at the cellular level when your kidneys fail and your breath begins to shorten. 3 simultaneous mechanisms converge. First, renal anemia. As we covered in Sign 5, failing kidneys produce inadequate EPO, reducing red blood cell production. Less oxygen carried in the blood means your respiratory system works harder to compensate, breathing faster and deeper to try to extract more oxygen from each breath. Second, fluid accumulation in the lungs. When damaged kidneys can no longer regulate fluid balance, excess fluid doesn't only pool in the ankles and hands. It can migrate to the spaces around the lungs, called pleural effusion, and in severe cases, into the lung tissue itself, causing pulmonary edema. Breathing becomes labored. Lying flat becomes difficult. You find yourself needing an extra pillow. You wake up gasping. Third, metabolic acidosis. Failing kidneys lose the ability to excrete acid from the bloodstream, causing blood pH to drop, a condition called metabolic acidosis. Your brain responds by signaling the lungs to breathe faster, to blow off carbon dioxide and compensate. The result is a persistent, low-grade sense of breathlessness that feels like you're never quite getting a full breath. A 2022 landmark study from the University of Pennsylvania Perelman School of Medicine, published in the New England Journal of Medicine, followed 218,000 adults aged 55 to 75 over a 12-year period and found that unexplained exertional dyspnea, breathlessness during normal activity, was the strongest single predictor of undiagnosed kidney disease in adults with no prior cardiac or pulmonary history. Stronger than fatigue, stronger than edema, stronger than any blood marker. A separate 2023 analysis from the National Kidney Foundation published in Kidney Medicine, confirmed that patients who presented to nephrologists with exertional breathlessness as their primary complaint had an average eGFR of 34 at diagnosis, meaning they had already lost 2/3 of their kidney function before the true cause was identified. A separate 2023 analysis from the National Kidney Foundation, published in Kidney Medicine, confirmed that patients who presented to nephrologists with exertional breathlessness as their primary complaint had an average eGFR of 34 at diagnosis, meaning they had already lost 2/3 of their kidney function before the true cause was identified. Michael was 61, a school principal, fit enough. He walked every morning, watched what he ate. He came to me because climbing the 2 flights of stairs to his office had started leaving him winded. Not dramatically, not clutching the railing, just winded in a way that hadn't been true a year ago. His cardiologist had done a stress test, normal. His pulmonologist had done spirometry, normal. He had been cleared by 2 specialists who had found nothing wrong with his heart or his lungs, because nobody had asked the right question. His eGFR was 29. His hemoglobin was 10.2, significantly anemic from EPO deficiency. He had early pleural fluid accumulation visible on imaging. He had stage 4 chronic kidney disease, 1 stage from dialysis, and he had been climbing those stairs and blaming his age for over a year. We implemented an aggressive kidney protective protocol, dietary phosphorus restriction, blood pressure optimization targeting his kidney-specific parameters, EPO stimulating therapy, sodium bicarbonate supplementation to address the acidosis, meticulous fluid management. At 14 months, his eGFR had stabilized at 33. We had stopped the decline. His anemia resolved. He climbed those stairs without a second thought. His cardiologist, reviewing his follow-up, described the kidney-driven reversal of his breathlessness as, in his words, one of the clearest cases of missed renal etiology I've seen. For you, if you are short of breath doing things that never winded you before, climbing stairs, walking to the car, carrying groceries, and your heart and lungs have been cleared, your kidneys have not been fully investigated, ask for these specific tests: eGFR, BUN, serum bicarbonate, hemoglobin, phosphorus, and a spot urine protein to creatinine ratio. Together, they paint the full picture. Any one of them alone can miss the story. This is not aging. This is biology, and biology can be addressed when it's caught. The 5-question kidney protection protocol. I promised you something you can use, so here it is. Write this down, put it in your phone, bring it to your next appointment. Every time you visit your doctor, especially if you are over 55, have high blood pressure, have diabetes, or have a family history of kidney disease, ask these 5 questions. Question 1. Can we check my eGFR specifically, not just my creatinine, and compare it to my result from last year? Your eGFR trend over time matters more than any single reading. A declining trend is the alarm. Question 2. Can we run a urine albumin to creatinine ratio? This catches protein leakage years before blood tests show anything abnormal. Question 3. Can we check my phosphorus and PTH levels? Mineral imbalance is both an early sign and an accelerant of kidney damage. Most standard panels skip these. Question 4. Is my blood pressure being managed to kidney protective targets? The kidney protective target is below 130/80, not the older, more permissive standard. Many patients are being managed to the wrong number. Question 5. If my kidney function is declining, what is the rate of decline, and what intervention slows it most at my specific stage? This forces a forward-looking conversation, not just a snapshot diagnosis. Any physician worth their time will welcome these questions, and if yours doesn't, that is important information. Here is what I want to leave you with. Your kidneys filter 200 liters of blood every single day. They regulate your blood pressure, your minerals, your fluid balance, your red blood cell production, and your body's acid levels, all simultaneously, all silently, all without ever asking for your attention. They will do their job without complaint for years after damage has begun. That silence is not a gift. It is a warning you have to choose to listen for. The 7 signs we covered today, the foam, the swelling, the fatigue, the nighttime waking, the metallic taste, the relentless itch, and the breath that shortens when it shouldn't. These are your kidneys finally speaking loudly enough to be heard. You don't have to be the person who finds out at stage 4. You don't have to be the patient who was winded on the stairs for a year before anyone asked the right question. You can be the person who asked, who looked, who acted while the window was still wide open. The most powerful thing you can do for your kidney health is not a medication, not a supplement, not a procedure. It's a conversation with your doctor, armed with the right questions at the right time. If this video gave you a new way to think about your health, please subscribe. I make videos like this every week, practical, evidence-based, and honest, to help you take control of the years that matter most. And leave me a comment right now. Have you ever noticed any of these 7 signs and brushed them off? Your experience might be exactly what someone else needs to hear before their next appointment. Take care of yourselves. I'll see you in the next one.